there's been at least 4,100 people injured in Gaza, almost 800 deaths. In fact, that was the data that we had from yesterday afternoon. We'll update that data today, of course, when we get the latest information. But that kind of injury toll is massive. It would strain any health system, particularly the weakened health system in Gaza. We had distributed supplies for 500 trauma patients prior to the conflict that had already been pre-positioned for several months, and they've been rapidly used up. And of course now dwindling electricity supplies, fuel and water makes it an incredibly difficult situation in which to provide care for patients. We need more trauma supplies. We need intravenous fluids. We need bandages. We need anesthetic equipment. We need surgical equipment, and all the different supplies, equipment, medicines that you may need for major traumatic injuries, whether they be head wounds, chest wounds, abdominal wounds, fractured limbs, and burns, and so on. It's fair to say we are short across all those areas. The trauma supplies and equipment, the supplies and equipment to manage obstetric cases, as well as to treat chronic diseases, as well as to treat other acute emergencies such as pneumonia and other infections and so on. The head of the UN team there is negotiating with the Israeli authorities, as are other colleagues at the highest levels of the United Nations, the Secretary General, advocating with the Israeli authorities to provide these humanitarian corridors and protect them. And again, it's not just a humanitarian corridor doesn't just give you access to an area. You need, once you bring the aid in, you need to be able to move around that area. We've been able to document 13 attacks that have affected healthcare. There's been at least 8 hospitals that have sustained some level of damage. There's been at least 3 ambulances that have been destroyed. We know that 6 healthcare workers have been killed. I don't know the details of their skills, whether they were doctors or nurses, but this is very, very concerning. At least of the 8 health facilities that have sustained some level of damage, at least 2 of them are hospitals. It's almost as bad as it gets. I think it is going to deteriorate even further with the expected ground invasion. It's not just the damage and the destruction; it's that psychological pressure of on those who remain, the constant shelling, the cutting off of water, the cutting off of electricity, the loss of homes. I've got 2 colleagues who've lost their homes in Gaza already, and the congregation now, people over 200,000 now, we expect in these UNRWA schools, and hearing the constant explosions and gunfire and so on takes an enormous toll.